Okay, buddy, you're on.
Okay, hi everybody. Thanks for joining me today. I'm going to cover a brief PrepMod user training. So for everybody's benefit, PrepMod is an online registration software that we are using. Or it's an online tool, web-based, and it's going to allow us to register and track our patients when they're here getting their COVID-19 vaccine. I'm here at the Senior Center taking this call. And so it's a pretty robust tool. It's new. The state of Massachusetts partnered with PrepMod to offer this to all local boards of health for no charge. So it's it's a great tool. We're working through it. It will make for a much faster clinic where we can push more people through. On my end, what I'm really excited about is we enter the data in and that people's individual are registering. The information will automatically upload to the MIIS. So that's the Massachusetts, database where they keep all of the vaccine information. And we're mandated by the state to report that information, I believe within 24 or 48 hours.
72.
Oh, it's 72. Okay.
Yeah.
We'll be pushing that out that day. So it's
Yep.
a great software. So bear with me. It's a little quirky, but it's what we need to do the job and do it efficiently. So again, this PrepMod training isn't for everybody at the clinic. We have some positions like runners or greeters or even our vaccinators don't necessarily need to be in using PrepMod and viewing PrepMod. So this is really ideal for anybody in check-in, registration, checkout, if they're helping people schedule second appointments. It's helpful also for staff, like the senior center staff here that may be fielding questions from the public. Like, I believe I registered online, but I can't remember when my appointment time is. I'll show you how we can go and search for a resident or a name and send them a confirmation and even their vaccine record or something along those lines. So at this point, we've had multiple departments all over town sort of step up and volunteer to help with our clinics. So it's not just the health department and the senior centers. We'll start here about our clinic. And Chief Parenti, I'm hearing a little bit of feedback. Would you try muting? I don't know if it's you or it might just be me.
It shouldn't be me, but we'll check. Hang on.
Okay. Yeah, we'll see. So here we are, and this is the floor plan for the senior center. Just want you to have a rough idea of what the flow will look like for our particular clinic. So residents are going to be pre-registered in PrepMod. They have a very specific appointment time. I believe appointment times are every 10 minutes. We'll be having 5 or 6 residents show up in 10-minute increments. They're going to enter through our traditional front door, and you'll walk in greeted with actually greeted by a temperature checker, and then we'll proceed to the 2 registration tables. With the 6 we're anticipating every 10-minute cycle, there's plenty of room to socially distance between the entryway, the registration tables. But if we did have some people come in early, we can socially distance them in the, what I guess we'll call the cafeteria to the left if needed. So they'll register. It's a very efficient process. All their information is already in there. They're going to proceed down the hall. So look to the right. You can see these red arrows. There's 2 treatment rooms. You'll see the 5 rectangles and the 2 rooms in the top right. Those will be 2 treatment rooms with 5 vaccinators. So one of those red tables for each vaccinator. That's going to be a fairly quick process like registration. We're thinking that's only going to be maybe 2 to 5 minutes, if that. The vaccination room, there are a set of questions our vaccinators will be asking, and then they'll proceed through the library, sort of cutting through near the fireplace, and then they head to this holding area. That's our full cafeteria. That entire space is open, but they're going to be in that observation area for 15 to 30 minutes. We'll do some scheduling I'll talk about. Then they'll proceed to 2 checkout desks. There's step 1 checkout, step 2, and then they're going to exit out that cafeteria. So it's all a one-way flow. So I just want to talk about PrepMod. So first, anyone who's using it needs to complete and sign an agreement. I have them here. They're up on my wall. We'll cover this when your first day you work. It's just a green little form. You assign an initial both sides, and we maintain that on site. And those user agreement, again, they could be requested anytime by DPH, but we'll maintain those here. And then as with any of these systems, it's important to note that it's with confidential information. It's very important to log out when you're done. Just don't close the browser. Always log out if you're stepping away. And you're not going to share your username or password or allow anybody else to use your account. So, you might do a half shift one day and say, oh, I'm just running out. Everyone that's doing one of these jobs where they need PrepMod is going to have a separate account. Okay. So this just is a quick screenshot to see what it looks like on accessing PrepMod. And I think we're all so familiar with using online systems. None of this should really be a surprise for you. But here's the hyperlink at the top. That will be bookmarked on any devices we have available at the clinic. You will type in your username. It's going to be your email. I think everyone on this call should have already received an email saying something about PrepMod user. If you didn't get it, please reach out to me. So you're going to put in your email. It does require a two-factor authentication. So you can either use your cell phone, and that's why I've asked several of you for your cell phone to register you, or you can do it through email. So whatever is convenient. I would say when you're at the center, you're not going to, maybe if you don't have email on your phone, it might be easier to get that text message, that text ID. So select that option. So again, you have two choices. Do I want that that code, verification code, sent to my email or to my as a text? And then you enter it in the below, and boom, you're in. So just I'm going to go over a little bit about navigating the web page and the icons. So there's really two different ways we can do that. There's a home page, and then there's also a website header. For the purposes of the staff on this call, there's really only three places you'll ever need to go. Clinic pages, there's a find a record, search a record I'll show, and then the logout button. So you'll see a lot of other buttons like, create a new clinic and export data, and you're not going to be monkeying with any of that. We'll just keep it really simple. So I'll show you the pages you will be using. So again, here's a screenshot of the home page. Once you've entered your user ID and you're in, you're going to see all these graphics appear. I've circled the ones you need. So again, it says start a clinic standard. It's just gonna, show your clinics that are available. There's also this manage clinic. So I think these two clinic pages you can use, find a record, and obviously the logout button. And then it also, if you're not on the home, it will appear like this across your header. Okay, so if you're on any page, you're gonna see that there's clinics, and then there's the record search. So these are the two buttons you're using. If you're just on any page, the logout is, you can find that by clicking that, person icon or the profile icon in the top right. So we're going to just go through flow. So you'll all be serving different roles. I think we talked a little bit about, who's going to be where this first clinic, but we want people to be cross-trained. The tasks aren't all that different, but just let's start off with the registration desk and what will take place there. So again, at the registration desk, we're going to, everyone's going to have today's clinic or the day of clinic bookmarked. Okay, so that's going to be on your web browser. I suggest you make multiple tabs, and we'll try to get those set up for you. So you click on that registration list. So here are all the dates. So as we move along right now, I have 2 clinics open. There could be more. You can search by the date. It will tell you here how many people are registered. So again, we're doing 100, and you click on the registration list. I'm going to do a little disclaimer for this week. Don't let your minds blow. For some reason with PrepMod, you can't make exactly 100 appointments. And so I'm actually running 2 clinics concurrently. So for the users, you just need to know they're either in this registration list or this registration list. So we'll have them tapped, and I'll have a list there. There's only going to be 10. So when you can't find the person you want and they said, I swear I registered, we're just going to click to that other clinic. They both have the same date, both the same time. They're just unique registration lists. Okay, and so the registration desk job is to, 1, greet the patient. You're going to ask their name, and you're going to click on their name and make sure they're in the registration list. At this point, we are not taking any walk-ins. If we do have a cancellation and we're going to slide somebody in, I'm going to take them off the wait list. You can see that's up at the top here. I'll do that as an administrator or chief parente, but you'll never need to create an appointment for someone at the registration desk. They're already going to be in the system. And so you can sort, you're all pretty tech savvy, here's the name. If it was me and I'm at my registration list, I would just have it sorted by name and scroll down, but it does show up as multiple pages. So you can also simply just type the patient's name in this box right here and click search. So whatever way you want to do it. Now, when we want to double check their info, and this is what we'll get into next, you're going to need to click on their name. Some are bold, some aren't bold. I'll cover that in another slide. So Al Smith's going to come in. Hi, Mr. Smith. So nice you're here. Great. You're going to click on Al's name, and then we will get to this. This will pop up. So we're going to see, Al's patient history is on the top left. It clearly has his date of birth. I'm already screening to make sure everybody's 75. So unless you look at someone's ID and you need to change their date of birth, we don't really need to screen for age. Everyone who's registered, it's already been screened. I had to kick out 3 people today because they didn't meet the 75 cutoff. So again, you're going to have date of birth, their phone number. So if you guys have a little bit of dead time and somebody didn't show up, feel free to jump on a senior center phone or ask somebody could you please call Dean? He didn't appear for his appointment. And then that way we could fill it with somebody else. So again, the email's there, and it will, this example doesn't show it, but their vaccination record, or sorry, their insurance card information will appear here. So we're going to ask, when you click on this screen, you greet them, you're going to confirm their name, you're going to look at their date of birth, confirm it's correct. We should also, have this on a license or some form of ID. Then you're going to, so you're going to ask for their ID and then their insurance card, and you're just going to make sure it's accurate. Just for a fact, if you're at the registration desk, we are billing insurance. We may be billing insurance, but with only for the administrative fee of the vaccine, it comes free from the state, but they will not have a copay associated. Insurance companies are not allowed to bill people. So they might be a little overwhelmed. You will not be billed. We're taking your insurance information. And if they have no insurance, there is a choice for that. They just say, I don't have insurance. So click no insurance. You're going to confirm their appointment date and time. As you can see in the middle of the screen, the first blue bar here, it just says appointment date and time. And there's their time at 7 o'clock. As we're getting ready for our seniors, we know many of them may show up early. And then if we keep running these, then we'll have like teenagers one day showing up late. But it's just something I think about. As long as we have the capacity and we don't have a backlog, I'm okay with checking people in early. You're going to see this with couples, right? Well, I got my wife an appointment at 8. I'm here with her now. Mine's not until 10. I would just check with one of our floaters in the hallway. If we have capacity, we can take them at any time during that window. As long as we're not saying, oh man, we're really behind. So we want to be flexible and get couples in together. Another thought about couples is they come in, if someone has a caretaker with them, we are allowing a single caretaker. Obviously, everybody's wearing masks. So it's okay if they want to travel them. If that person doesn't really need the help, they can wait in the car. They can wait in our big observation room. We want to try to reduce people in treatment rooms if possible. So you again will confirm their appointment date and time, and then confirm their eligibility. This group, it's really easy. It's 75 and over, so that's already been done. But they should have proof of residency. So Andy, as our town clerk, is going to give us a copy of the voter registration. And so I did tell people, if you're a registered voter, we have your proof. But for anybody else, we may be looking for that just by a license, or they could bring proof of a bill or anything like that. But right now it's just open to Northborough residents. So everybody should have a Northborough address. And we will have the last final step here. So you've confirmed everything, their insurance is in, their name's there, they qualify, and then you're gonna give them their patient intake form. This intake form, we're gonna make them gold or yellow just to make them stand out and look different. And they're gonna be pre-stickered with their name at the top. So that's also gonna let us know like who came through, who didn't come through as well, in case we had a problem with our connection. But they're going to take their patient intake form and that's found in a pile, and then we're going to direct them down to the vaccination hall, where a greeter will meet them and let them know which table to go to of those 5 tables. So you don't need to know which table they're going to or which room. Just say, please proceed down the hall, and they will help you with your vaccination. So Chief Parente, he's very inquisitive and he likes to figure everything out, and he had to know why the registration list names were appearing differently. So again, this is all fake data we're looking at. This is off the training website. So if the name is bold, they what? Well, let me go through this. So the names are going to look different. And bolded names mean they answered yes to a screening question. So I'm pregnant, I'm nursing or breastfeeding, I have high blood pressure, whatever it might be. And there's a list of these 10 screening questions that come for the, the emergency authorization approval. You at registration don't need to worry about that. Okay, so if someone checked yes, I'm pre-screening them now. There is nothing that would disqualify anybody. We are going to highlight those names and let the vaccinator know that the first time they answered the questions, they said yes to one of the 10 screening questions. They can, in all likelihood, still get the vaccine. The yes might be, I once had anaphylaxis or a severe allergic reaction to a bee. So you can still get the COVID vaccine. We're just going to hold you for 30 minutes. So there's these tweaks. It doesn't mean they're disqualified. Don't worry about them being bold. And then if they have a shield, so do you see Mitch CT Kemmer here? He has a shield next to his name. That means that he uploaded the image of his insurance card. Again, for you, it doesn't really matter. We're going to look at the data's there. The numbers are there. And if we have questions, I'm sure we're going to learn a lot on this first clinic. And then lastly, you can see under Mitch's name, he has that pen or icon. Oh, sorry. The pen or icon means they uploaded the insurance card. The shield means their insurance information is already there. So you'll probably figure this all out on your own too. So there's the mystery. Thanks you, Chief. And so now editing a record, right? So somebody came in, they have a wrong, they have the wrong date of birth. Their insurance information isn't there or it's not accurate. And so what you would do is we have to get out of the registration screen. So for that reason, we're going to want you to have, I guess, 3 tabs open. You're going to have tab for registration list 1, tab for registration list 2, and a third tab is just for searching a record. Okay, so you search for the record. So again, there's 2 ways to get there. At the top of the screen, it's going to be that header. It's going to say record search, or if you were to click the home page by accident, there's a very obvious icon that says find a record. So again, you just type in their last name, you search for them, and then once you see their name appear, you're just going to hit edit, and that's circled on this screen. And so this just shows you the screen of how it works. You just type in the correct numbers and you should be good to go, and you hit save and continue. I just want to stress to everybody that we do not need to upload the insurance card at our clinic. So you're all have good eyes, type it in, double check that it's right, and hit save, but we're not going to get in the habit of trying to upload images of insurance cards. Okay, so the key thing is just make sure you hit done or save. If you just go to that screen and make the change, it's not going to work. So just note that you will receive this pop-up that successfully updated patient. So make sure you're seeing that. All right, so we've covered registration. Actually, you know what? Why don't I take a minute? Do we have any questions while I'm on the registration?
I have a quick question.
Yeah, go ahead, Allie.
When you come in, say you have, and I agree with the seniors, I think you're definitely going to have people randomly just coming in 30 minutes early or, 20 minutes early, however it may be. If the registration desk is right in the front and it's really cold out, are we just going to let them in and go in the cafeteria and wait? Is that what you were saying? I just want to make sure, because I don't want anybody to feel like they have to wait outside.
Yeah, I don't think with our what we're anticipating on numbers, we don't think there's any need. We'd be able to socially distance, 5, 6, 7, or and if we need more, we're going to move them. So especially with this group, nobody's going to be waiting outside at this time.
The only exception to that, if they come an hour and a half early, they're gonna have to wait. If they're just a little bit, that's not a problem. But then we're going to end up filling our observation room if they're there too early. The other concern is people who are showing up and saying, well, I just want to see if there's an extra shot. No, they don't stay.
Okay. And if you have inclement weather on a Friday, is Friday the only day that you're going to be doing this? How would you reschedule that?
Yeah, that's a great question. So this just happened for a lot of local boards of health holding clinics with the big storm on Monday. There is a way where we can move the clinic to another day. And it sends them a notification, which if you have email, it's super convenient. But I think we would need to call everybody, all of 100 on the list, to let them know we've moved it to this other day. Luckily we don't have to worry about that this Friday. I think depending on staffing, we're going to have to pick a different day the following week. This is easy. This is the first dose. So we're not doing this, trying to figure out second dose timing. So it would be scheduled for sometime the following week.
Okay. And as far as like where people are going to go, are we going to do the same thing every week? Are you going to send us kind of a list of what we do to change it up, or how is that going to work?
Yeah, if we were more prepared, yes, you'd have a really clear list. So we'll be working, I think I'm going to set up a sign up online. So, that's private to our group, just so everybody could see, oh, I'm on the registration desk this day, that sort of thing. So we will, we're going to have that all sorted out. I think Chief has it all in the spreadsheet, but we could let you know definitely by tomorrow what role you'll be serving in.
Okay.
And I love for those of you, if you don't know Allie runs a rec department. So this is so perfect to have her on this call because this is all she does is registration. She's thinking of it all. This is her world. Thank you. Okay. Any other questions on registration?
Yeah, right now, this is what we're using for tracking people, Allie, just so you know.
Just an Excel sheet?
It's just an Excel sheet, and it's on the other page.
Okay.
Okay.
And Kristen, if there's anything I can help you do during the week offline to get ready for this, please just call me, okay? Because I have no problem. I can make phone calls. I can, I can set up these sheets for you. Just let me know.
Okay, I'm going to take you up on that. Watch out.
Yeah, what I foresee is and Kristen has talked about this several times, is if this goes on as long as we anticipate it to go on, and then we start getting more doses, and then we start getting booster shots, maybe. Now we're going to need more volunteers. We're going to need more people because people are going to get burned out doing this every Friday. So at that point, we're going to need to expand our pool fairly quickly, we think, and that's a concern. So we'll definitely need your help with that.
No, I mean, it's right now is a perfect time. I think once we get into April, I'll probably not be as available as I am right now. But as much as I can do offline, I have no issues trying to, take some of the work from you guys offline. I can definitely help out with that.
Okay, great. Awesome. So, all right, I'm going to pull this presentation back up. Okay. Okay, so vaccination rooms. Let me jump into this next role. So this is a lot on one slide. I just want to step by step, just take you through vaccination. The good news is for all of you who are doing registration, you're not really there in the vaccination room. But I think it's important for you fielding questions, you just understand how it's going to go. So again, where you have 2 vaccination rooms, you'll see when you come here, they're down the hall on the right. They're normally the activity rooms, that are down the hall by the billiard room, if you know the senior center. So again, there are 2 rooms with a total of 5 tables. So the tables are numbered 1, 2 in the first room, 3, 4, 5 in the second room. So again, there will be staff in that vaccination hallway instructing the patient. So you're just going to send them in that direction. We have clear signage that says, this is authorized only. Don't go down by the offices. And there will be someone to greet them and send them to that table. So again, they're going to have that gold or yellow form in their hands, patient intake form, which is going to have a sticker at the top with their name and date of birth. So they're going to give that form to our vaccinators. So again, our vaccinators for our first clinic are our fabulous advanced EMTs and paramedics. There's going to be obviously 5, and we even have 1 floater. So they have a list of questions that they'll have in front of them. Again, these are on the CDC's or the emergency use authorization form. So we have to have them ask those questions, and then they're going to have the patient sign their name stating that, how the questions have been answered truthfully. They're going to, on the back of that form is more information that's filled out by the vaccinator. So again, the vaccinator is going to administer the vaccine, right arm or left arm. This is intramuscular injection. And the vaccinator is going to complete the back of the intake form. So the back of the intake form is going to say name of vaccinator. We'll talk to Chief offline and we'll give you detailed instructions. He says the handwriting of some of his guys may not be the best. So it might just be very clear initials, because the people at checkout, we'll get to that later, are going to have to register, enter that info. So again, it's going to be right arm, left arm, name of vaccinator. They're also going to they're going to include the time the vaccine was administered. And then they're going to check a box to say either 15-minute wait period or 30-minute wait period. And that's the determination of the vaccinator based off of those screening questions. So if they have a history of severe allergic reaction to bees, we're going to hold them for 30 minutes. If they're on blood thinners, I believe we're going to hold them for 30 minutes. So that's the determination of the vaccinator. It's all in the back of the card. So if you were to have a resident walking around going, I don't know what I'm supposed to do. There's clocks all over the senior center. Chief made sure they're all accurate and giving the same time. So you look at the clock, you'd say, oh, it looks like you're still in your observation period. But so again, the vaccinator is going to complete the back of that intake form. They are going to initial that COVID-19 vaccine card. I put a little image of that on the left. Keep hearing about those, on social media, et cetera. And then the vaccinator is going to give them all their paperwork. Okay, so their paperwork is going to include giving them the yellow intake form back, giving them their very own COVID-19 vaccination record card. They'll be excited to have. That's a small piece of paper. They also, we are required to give out the EAU. Again, that's the emergency use authorization patient caregiver form. This is your usual, like you get your flu shot, and it's, you know, it's like the informational document, but it's very long. So that will be stapled. It's yellow, it's white, and then we have this V-Safe health checker form. This probably is going to be a little confusing for our seniors. This is a cool app and blah, 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 you know, that is the federal government put out. They want us to give this information, but it's absolutely voluntary. That's a blue form that we have ready. Don't let them get overwhelmed with all of that. But it's going to be, again, their gold intake form, the white EAU form, this blue V-Safe health checker, and then that very important COVID-19 vaccination record card. And that will be pre-stickered, and it will have the vaccine lot and the date of administration on it. So again, they're going to be instructed to proceed down to the observation room. Oh, and I just want to note, our vaccinators, although they're going to show up in Prep Mod, and I'll talk about that in a minute, they are not using Prep Mod in the vaccination room. So everything is on that gold hard copy intake form. So now we're down to the observation areas. So they've they've entered the observation area. It is a seat yourself area. The chairs are all spread out with 6 feet of social distancing. And one of the important roles, and you on this call may be helping to do it, is especially given we have our seniors 75 and over, we're going to have staff floating around while they're sitting there anyway for 15 minutes. It's really important to be efficient that we book them their second appointment. The worst part of Prep Mod is it does not allow us to clone or copy their registration or move it. They have to go through the online registration form again. And so the purpose of having extra staff out there is you'll be doing that for them. So we'll have our clinic link for our clinic 4 weeks away already up and running. That will be bookmarked, and you'll have that on your screen. We're going to have tablets available. You're going to walk around. Our seniors are at that point should already have their license with them or some form of ID. They're going to have their insurance card, and you're just going to help them enter it, or you're going to do it on their behalf. And we do, again, it's 4 weeks away. So with Moderna, that's what we're administrating. We're not doing Pfizer. So Pfizer's 3 weeks apart. Moderna's 4 weeks apart. There is a bit of a grace period. You could go 4 days early, but again, we're running this clinic 1 day a week. So it's going to be, 4 weeks away on a Friday. If for whatever reason they say, wait, I'm in New Hampshire that week, I can't do that. That's something we're going to have you talk to an administrator about. I'm hoping all our seniors will make it a priority. Otherwise, we're going to, they can take it later. So again, you can't take it any sooner than 4 days early, but you can take it on week 5 or week 6 or even week 15. But it's most effective for protecting yourself against serious illness to get those immediately, like as soon as you can at that 4-week mark. So let's see.
Can I ask you a question about that?
Yeah, sure.
So if you're doing 100 in a day, okay, and you do them for the first 3 weeks, then those same 100 are going to come back the next 3 weeks, and everyone has to wait until those are done, and then you would start with new people again. Am I saying this correctly?
Yeah, this is why in public health we're all tearing our hair out right now. So what we're told is the way allocations coming from the state, when I put in my order every week, I have to say, this is what I need for my first dose, and this is what I need for my second dose. So they prioritize the second dose. We're being told as long as we request it, we're pretty much guaranteed to get it. And so yeah, so if we were to run this clinic on Friday and we get vaccine for 3 weeks, but they're only giving us 100 doses, we will not vaccinate anybody new on week 4, right? Because we're going to revaccinate or do the booster shots. But my hope with the state and allocation is maybe at that time we'll have more from the state, so we can do 100 first dosers between 9 and 12. And then we'll be able to, or sorry, second doses or whatever. And so, yeah, that is something we have to consider in our planning.
Okay.
Okay. So that's registering in Prep Mod. I'll talk about that a little bit more on the final side. So, so they get their appointment while they're sitting in their chairs, spaced 6 feet apart. I mean, for those of you who are helping with appointments, You are going to be close to that individual possibly to help that senior. You're going to have to ask them 10 questions. So we have a very large room. I would say spread out as much as you can. We have face shields available. We have eye protection available. We have masks available. You know, the new thing, right, is layering your mask. So it's wearing a cloth mask over a surgical mask. And we want you to do what you can to protect yourself and try to distance as much. We know it's a little difficult in this situation, but again, you should be able to stay several feet from the patient, maybe just ask them to hand your cards. And this transaction or this interaction with the patient should be no more than 5 minutes. And so anyway, so once those are made, that will be in the observation area. They'll proceed to the sort of closest side to the driveway of the cafeteria area. And there's a clear sign that says checkout table 1. So it's a 2-step process. So start here. Checkout table 1, the patient takes their intake form, the gold form, and they hand it to the checkout person. That person, this is probably the quickest, easiest job is checkout table 1. They're just gonna say, oh, hello, yep, and they're gonna click. We're gonna have it linked, and I'll show you that in the next screen. They're gonna look at the back of the form. They're gonna make sure the patient has met their 15 or 30-minute period. They'll record the outcome. Again, I'll show you that in a minute in prep mod. And then just to review, the second table is going to, they're really a confirmation courtesy table. They're going to confirm the second appointment appears in prep mod, and they're going to give the patient an appointment card reminder. And so we're having business cards printed, which is the way our seniors are probably most familiar with getting their, like, remember your doctor's appointment is coming up. So we'll give them a very traditional appointment reminder card on there. And so just to clarify, that gold or yellow intake form is going to stay with checkout table 1. And at checkout table 2, they'll be giving them their little appointment card. They're sending them with their, they'll still have their COVID vaccination card. And then they're going to go home with those 2 handouts I talked about. So again, checkout table 1. You find this, we're going to have it bookmarked at that table, but it's under clinic activity. So again, I'm going to click on that clinic or, you know, start a clinic. I'm going to find the clinic I need. Again, we might have 2 running concurrently, so you'll have 2 tabs, and you'll be in the clinic activity page that you can see circled there. So this is what the clinic activity page looks. It's really simple. It's like 4 circles, like pick your poison. So you can search by their name. That might be the easiest. You could put their first name or their last name and hit search and it will appear. You can also sort it. So whatever works well for you. And you're going to need to determine they were vaccinated, refused, sick, absent, or withdrawn. We are pre-screening everybody, so I hope that we're not going to be turning anybody away. Administratively, we'll handle the absence at the end of the clinic. If they're sick, again, they wouldn't be getting to you at that desk. Most likely that's something we've done. There could be some people that, you know, are read the fact sheet and might get cold feet and refuse, and that's okay. We can check them out. But I think I'm hoping for 95% or more, you'll be checking vaccinated as part of the closeout. So this is how it works. So again, oh, that Moderna slipped up in my presentation, but that was supposed to be covering the Bexero. But anyway, that's what it's going to look like. It's going to auto-populate what they got because they already registered for that product. So you're not going to have a choice. It's going to be Moderna. The lot number is already in there. Our lot number of the 100 is all the same. Again, you can't even edit that, so don't worry about lot number. Route, IM is intramuscular. That's going to be the same for everybody. This is an intramuscular shot, so IM for sure. And then you will need to select right arm or left arm. So, you know, ask the patient, and it's also on the back of the form. So to tell you the truth, you don't even need to ask the patient, but you will have to ask about a reaction. And I'm going to cover that in a minute. The vaccination date, I believe, is auto-populated, but it's going to be the date that we're there. So again, on the reaction, so this is because it's an emergency use authorization, there's this whole, you know, requirement to enter this reaction into this online system. So there's really 4 choices under reaction. I hope for the majority, you'll be saying none. Local just means that they're having like severe local pain at the injection site. Some people could have an immediate allergic reaction, like a rash or something like that, which is very different than going, you know, having severe allergic reaction of anaphylaxis. So, you know, I wouldn't dig in too much. How's your arm feeling? I think everyone's going to say it's a little sore, you know, I can feel it. But we're talking about people that are having severe local pain and immediate discomfort. while they're finishing their observation site, so it's, ow, my arm is really hurting me. So it's more, how are you feeling? Are you having any issues? Might be a good generic question. And so the next one, Chief, I'll say it wrong. So it's syncope.
Syncope.
Syncope. See, I always want to say it wrong because
I made
nobody
you fainted.
uses that word if you're not.
Oh, we do.
You do every day. For general public, that means fainting. Okay. Yeah. If they faint, you're going to know it because I'm sure it's going to be, a big deal, and we'll make sure that's marked on the form. And so hopefully we're not seeing much of that with our great dividers and all the rest set up. And then lastly, again, anaphylaxis. So that's going to be EMS came in and assisted this individual. And I just want to stress to you, EMS is available. You are not responsible for being trained in CPR and responding. But again, as I'm panicking everybody over this, the chance of an severe allergic reaction are very, very low. They're only seeing that in 1 in 400,000 vaccinated. So fingers crossed, hopefully we won't be having that situation. So again, make sure you hit the update button. And lastly, I just want to see vaccinator, which is on this form here. The vaccinators' names are pre-populated. You'll have a drop down of 6. So you're going to be matching it up to what's on the back of the intake form, which is going to, I believe, be off initials, but we'll work that out on the first day. So again, so that was table 1. They have closed them out of the system. It shows they've been vaccinated. We know what they received and we know if they had a reaction. And so now it's just the table 2, which is our convenient appointment reminder. So again, this station is going to have bookmarked our second dose clinic. They're going to have it sorted by name so you can quickly see it, or you could just search for it. And you're just going to say, what was your name, please? You're going to find their name, and then you're going to fill out the little appointment reminder card for them. And you don't need to do any action. So this is really, I'm just going to look it up. I'm going to confirm that, it did go into our system, and I'm going to write that day down for you. Our appointment reminder card is going to be a little different, but ultimately you write the date of the clinic, which is going to be right on the screen in front of you, and the time. And so lastly, what are they leaving with? So I just want to make sure this is visual. They're leaving with 4 things. Their appointment reminder card. They're going to have that EAU patient caregiver form. It's several pages. It's just sort of white and plain looking. They're going to have the V-Safe Health Checker form, which is going to be a blue piece of paper, double-sided. And then lastly, their vaccination record card. We should instruct them that they should bring the vaccination record card to their next appointment. They didn't bring it. We just give them another one with their second dose information. Again, it's all being recorded into the online system, and we can email them their patient, their vaccination record if needed. So I think that's it. So I'm just gonna quickly go through, just reviewing. This is the whole step, okay? So again, registration and observation staff are using PrepMod. Vaccinators are not using PrepMod. So the registration desk will confirm name, date of birth, appointment, eligibility, and insurance information in PrepMod. And they'll make edits if needed and make sure to save and update those edits. Then the registration desk is going to hand the patient their intake form and kindly direct them towards the patient to travel to the vaccination hallway, where we'll have staff member that's going to help them find a table with an available vaccinator. The vaccinator is going to complete the back of the intake form, and the patient's going to take that with them, move through to the right of the fireplace and on through to the cafeteria or observation room for their 15 or 30 minutes, as noted on the back of their form. The staff will be moving around. So this is separate from our 2 checkout desks. We're going to have 2 more staff members that are going to be floating around that room and helping people on tablets schedule their second dose appointment. And then again, once they've met their 15 or 30-minute observation time, they go to checkout desk 1. Most important thing, they leave that intake form. This checkout desk 1 is going to confirm the observation period was met, enter the outcome in PrepMod, and then move on to the next desk where they'll confirm a second appointment was successfully made in PrepMod. And if not, we'll have someone come over to them with a tablet and do that, and then give that patient that appointment reminder card. So I think that's all I have. I don't know if you guys have questions. Sorry if this was a little long. We're just trying to make sure you have a good handle as to what's happening.
Kristen, I'm sorry. I know I seem to have a lot of questions, but I used to volunteer helping with giving blood and things like that. And one of the things that we dealt with was that people didn't want to wait that period afterwards. And I can see maybe some of the 75 and older group or even the 65 and older group, just saying, yeah, I'm just going to go? You know, is that something we can't force them to stay? Like,
oh, we will. We will.
Oh, okay.
So this is not your average flu shot, you know, which is FDA approved. This is an emergency authorization, and that is absolutely required. So we have EMS there, and, you know, while they're class Bs and they can look professional and get mean. So, you know, they're probably a good person. So you can be the nice one. We'll let them explain to them that this is required and necessary.
Okay.
Yeah, Allie, we're going to have, so in that observation room, in addition to the people taking or scheduling second appointments, I'll have my people in there observing, walking around, talking to the people. If they say, can I leave yet? It'll be, no, you can't leave yet. I'm sorry. You know, we're bound by the state rules, and et cetera, et cetera, et cetera.
Perfect. All right. I was just curious. That
Good
just seemed like
question.
something that might come up. That's all.
Probably will.
This is very well put together, Kristen and Chief. I know, I mean, this is, you guys, I don't know who was put together on this, but in such a small, short period of time, I mean, this is, and I'm so blown away. I'm so impressed. Great job.
Thank you.
Kristen, I was just going to add regarding the wait time. I'm assuming they're gonna know that's part of the requirement when they schedule, and we could even maybe remind them when they check in. I mean, and typically, Chief, it's probably normally going to be 15 minutes for the majority.
Without question, the majority will be a 15-minute wait time. There'll be very few. Very few 35. 30
by the time we get them registered for the second appointment, I mean, that's going to go by really fast.
Yep.
That's good though.
So here's a copy. This is what the intake form looks like. All these questions, and some of these things they're going to say, what the hell's polysorbate? Okay. Have you ever had a, you know, so we know most people, if they know they're allergic to something, they're going to know. If they say, I don't know, I'm allergic to polysorbate, that's good. That means that they're not. And then this is the back of the page that Kristen was referring to, that if you're working checkout, this is what you're going to see. The vaccinator's name, left or right, 15-minute or 30-minute time of vaccination, any reaction, except they may say local reaction, you know, when they gave it to them, so you can see that. And the vaccine lot number, we don't actually have to put on here because it'll be on the front of the other card. So, and Kristen, we're going to put those cards with the intake forms that are pre-printed at the registration desk, I assume.
The Moderna cards?
Yeah. So the
COVID-19 vaccine cards, those actually have to be initialed by the vaccinator.
Right. So, but they need, if they're going to be pre-printed, they're going to need to be with their intake form because they need to go to the right table with them.
Right. Or we just have blank ones because they're all going to say the same thing.
Blank ones are fine.
Yep. Yep. So I think we'll just leave blank ones and we'll let them fill them out. You know, they'll just write their name on the front and sign on the back.
Yep. I agree. Okay. It's been so much fun doing all this. I can't tell you.
I got a couple of questions really quick. So you talked about proof of residency. So people who, are we asking people if they're registered voters ahead of time? And then we're going to check them on the list? What do we do if someone shows up and they're not a registered voter and they don't have proof of residency? Are we?
You know, when you get down to it, I want to see people vaccinate. I mean, because we're investing town resources in this right now and we have town staff, we're serving residents. At the end of the day, if someone from Westboro snuck in, you know, am I going to turn them away? You know, I don't, that will be a decision we make. You know, I wouldn't advertise it. You know, at the end of the day, if they're there and they're ready and they qualify and willing to do that, if they just can't prove it, we're going to go with it. But, you know, we're just looking to do our best with it. So what I can do with Andy is we could even pre-screen people for residency off that list with our voter registration and maybe even put a sticky on the ones that we need to confirm residency. So I'm hoping that's going to be pretty simple. I think most people are going to have an insurance card or something. But we did, because I thought our seniors might be overwhelmed if they didn't drive or have an old license available. We did say we can check it off the voter registration. So if they say, I don't have anything, we'll have 2 copies of that list floating around. So you could just look it up and we have our own evidence.
So what do we,
I'm
what
sorry.
do people have to come with? They have to, they have to show ID of some sort? Okay.
Yeah. So ID with date of birth. Yep. So we're telling everyone to bring your ID, and that's, I believe, all on the in the prep mod. Certain things are modular, right? And it's all the same thing that's going out. They'll automatically receive a reminder 24 hours before the clinic, but I can also customize a message to anybody in the registration system, which is probably what we're going to do, to say, please don't arrive early. We're asking you to arrive right on time. Let them know if they need assistance with parking, that they can pull up to the front. We do have 2 wheelchairs available. We can, I'll probably do that. I'm writing notes as we think of this. The reminder of short sleeves, and make sure they bring we'll say a photo ID, that's going to let us do our date of birth.
And their insurance card.
And their insurance card. Yeah.
So they're okay. The second question is unrelated to that, but you talked about you had to set up 2 clinics, individual clinics in prep mod. So when people are checking in and checking out, are the people who having to do the checking in, checking out, they happen to go to each one of those clinics to find the person? Or is it, okay, so you're gonna have to search, and then they split 50-50, or is it like? No,
it's only 10, and I could even print the cheat sheet list, so if you're looking for them and you can't find them, they're just gonna be in the other list. So there's only 10. 90% of yours are all going to be in the main clinics. And so we'll just have that other page available for you.
All right.
And what to complicate things further, there's actually then additional clinics because of the rescheduling. So it's crazy. It's prep mod's not friendly.
Chris,
go ahead, Andy.
I was just going to follow up on the residency. If you send me the list for Friday, or I guess I can get it right out of prep mod now that I have an account, I can easily just check everybody in advance, and that they're listed as a resident or a voter in my system. So that's really easy to do since there's a small number.
Okay, that would be awesome. If you can do that between now and Friday morning, that would be great. And maybe you just say, guys, don't worry about residency, we got it. Or we could just flag the intake form with a big sticky that just says check residency on this one. So that would be super helpful. So for everybody who's in prep mod, Chief's showing you here, you all have access. And I believe you can't do anything horribly bad, but don't delete. I guess you could. Well, Chief could hit delete.
If there's a red button that says delete, stay away from it.
Stay away from delete. We trust all of you. But so you can, Andy, you can download the registration link. So we only have 2 clinics appearing, but the time Friday comes, I'm going to have at least 1 or 2 more for depending on how well I can schedule it for the next time slot. So that's something to keep.
And Becca, if you can see here, answer your question. The second clinic only has 10 spots right here, right? So the majority of the people are in the first clinic here. If we go to look in the first clinic, they're not there, then we can go in the second clinic.
Click in that. Can you search by name?
So if I open up here, okay, here's my registration. And then I can click here, record search, and I open it in a separate link.
Can I just search right there? Search patient's name? Okay.
You can search here.
Can search there, but the only thing about if you're searching within a registration list, it doesn't have an edit button. You're just viewing the registration. Okay. So if you want to edit a record, you have to use that search feature too.
So yes, that's why all you're going to do is click on search and open it as in a separate tab. So you can jump back and forth between the 2.
Okay.
And when you update this, it updates almost immediately in prep mod. So if I update something in there and you go back to here, you may have to exit out and then get back into that particular person. Like, so if I'm in here, I may have to get out and come back in for it to update, but it'll update. So you can see all these people. This person answered, I don't know. That's why they're bold.
Okay, how do you not know if you're taking a blood test?
Oh, you would be amazed. Just amazed.
Hey, at least they didn't say, I don't know about being pregnant,
This is true. I didn't see any pregnant issues at all.
Messing with us at that point.
There's a whole TV show about that. Going back quick to the check-in with if they are going to give the ID, does it make sense to take it and verify that the date of birth's right, that the name's right?
Oh yeah.
Yes.
Okay, so I'm just thinking that probably still would be a good procedure. And also, like, I noticed when I was just looking on prep mod real quick before we started, like, I noticed one name that it was like entered twice, like it was like Mary Smith on the line. So I'm assuming we should try to edit things like that if we come across it.
Yeah, if you found out they entered it twice or something. There's one other check I need to do. I realized this morning, we're learning so much this week. Someone had gone in that 45-minute window to sell out all our appointments. They went in and they added an appointment and they checked the first dose box. And then they went in and they made a second appointment for the same day for their second dose. I think they wanted to make sure. So I was like, why is this name appearing twice? It says you already got Moderna. So I have to scan for people maybe that duplicated, or maybe got so nervous they didn't get an appointment registered twice. So I'll be screening for that as well. So yeah, let me know. I mean, where I'm housed right now at the senior center, I'm in that front office. If you weren't on the walkthrough, my thought is, Chief's going to be back babysitting the vaccine and his guys in the vaccinator room. I will be out front here, not with a full-time job of doing a check-in desk, but really to float around, troubleshoot, and help you guys. So I'm sure we're going to learn a lot. So if you want to double check and say, I think I'm doing this right, or should I edit this, please just call me over.
Yeah, we already learned a lot about this waiting list that we learned. We got to deal better with that next time. But we're getting there. That's it.
All right. So thank you so much for all of you. And sorry if we made it a little too long. Hopefully at least all the roles and we can really fill in. Over time, like Chief said, as we bulk up, we will be pulling in more volunteers. We may even have some volunteer nurses. I've sort of just been out so flat. We didn't have the vaccine till Tuesday. It was Tuesday, right? We were so afraid to really, rally the troops until we knew for sure, because there's so much, there's such great shortage of the vaccine. So we have a system. So if you know others that are really like ramped up, we're interested in expanding our staffing. So we're not relying on paid town staff forever. But again, we're looking for a weekly commitment on Friday. So if someone's like, hey, I'd love to see it and check it out. No, sorry. Like we're running an operation in the middle of a pandemic here. We can't have people hanging out. But if people really are committed and they want to give time administratively to be a volunteer or a vaccinator, if they have at least ability to do a couple clinics, or at least every other week for a vaccinator, they're a little bit tougher to come by. We're wide open. So more to come. And I really welcome your feedback. This is new to all of us. We're making and breaking things and really figuring out what works. So I appreciate the skill set in front of me, and I really want to hear your feedback on how we can make this better. So thank you. Oh, Andy.
Just one quick question. As far as our schedules go, at least initially, how's that going to be determined, and when will we know if we're working on Friday or not?
So yeah, Chief, we're gonna have to follow up under this and just plug some people in. So Andy, this Friday wasn't good for you, right? But maybe
I have two conflicts. I mean, I can make it work if you need me, yeah. But I do have two conflicts.
No, you had conflicts, and like Allie has conflicts as well. That's why we pulled Teresa, and it's awesome for thanks for helping out. If we need to pull both Katie and Angie, they're available depending on their schedule. I have Diane here. If you guys all haven't met, our new health agent, and who's covering mostly food. So we're gonna fill it in. So Allie, I'm gonna talk to you after this. You said you'd offer help. I think what we need is a sign up where we can all share the link, and we could set it up for multiple dates. Chief and I will talk. So we're gonna say I need checkout desk 1, checkout desk 2. That way you can have access and plug yourself in, or just say I can't, So okay. If you're available every Friday. So Allie, if we could, clinics may not happen, but if we build a my sign up or something like that where we could all see it, save it privately, make it that we can see each other's names. And then it's going to be the same thing every week, right? Same thing every week. There's going to be this position. We need 3 of the, Chief right. Could put in the vaccinators we talked about. He doesn't want to let all his guys monkey with stuff. So Lorraine was going to likely enter the vaccinators' names, or Chief, on their behalf. But I think for all of you on this call, we'd give you access and let us know, and we'll start plugging people in, for the next month forward, that sort of thing.
Becca, you just sent an email. You didn't get it. You didn't get an invite to Prep Mod.
I must have wrote your email wrong or something. I did put it in there. I'll double check that and get back to you, Becca. Okay.
Allie, I'll send you the list we're using right now with the various positions. You'll see some of it's populated. One thing we are trying to do is to stay consistent from week to week to week, so people get good. That doesn't mean that they can't switch positions. You can do registration one week and check out the next week, but we want you to be familiar with Prep Mod, and we don't want someone who's going to do it for one day, be gone for 4 weeks, and then come back, because that's just right.
Well, I think everyone here is committed to doing it. Yep. There just might be one day, like I know.
Oh, very much, yeah.
Obviously, I can't do it, but I'm available every other Friday. So Yeah, if you want to send me that list, I can
You
set
got it,
something.
buddy.
Okay, you already got it. Start plugging it in. Thank
I'll
you,
send it
Ally.
to you in a
Yeah,
minute.
so plan Fridays, yeah, 9 to 12. So for this Friday, for those of you, so I think Andy's out and Ally's out. But I believe I'm expecting, I know David's here as our support with IT. I don't know your availability, David, but I'm planning on everybody else. So if you can all get here, including Becca, if you can all get here at 8 a.m. on Friday, we just don't want that frantic rush, right? We'll have you with your tablet. We'll be walking around. It gives us a good half hour to make sure everybody's got the link, knows where their supplies are. And then we might even start taking some of the seniors a little sooner than the 9 o'clock mark, because I think they're probably going to show up a bit early.
So right now we have Haley and Diane in checkout. We got Katie, Lorraine, and Liz in registration. Got Becca doing temps. Got all the other positions filled, but this is where we're still hurting.
So the assistant chief, that would be, well, Teresa's one of those for this week. That would be, I think we should break it into.
Teresa's over here.
Oh, we do have Teresa on second shot. Okay, now you're
Because
putting
we need 2 in there.
Okay. And then we would just have general support.
And this is these are the people who are pointing, go that way, vac room 1, vac room 2, running the vaccines back and forth, all that stuff.
I think we could probably get away with 2. But I know
at least 2,
more.
because what we're going to need, we need 1 to run the vaccines, and we need 1 or 2 for the directions to go to vac room 1 or vaccine room 2. So if we can get 3 here, that would be great. I know Scott's not going to be here, is he, this week?
Scott's here this week. That's
Scott's
my
here
Scott.
this week. Yeah, see, that's her Scott. This is my Michelle. This is my Haley.
All right, my mom's a vaccinator, and she's coming the following week as long as we get vaccine. Diane, remind me. We'll see if maybe we could slide Shane in if he has availability on Friday. And why don't can you pencil Shane ? Under assistant?
Shane what?
Wagner. And I can easily pull in MRC. I also have others available, but we'll get that sorted today.
One of my guys whose wife is an EMT, she has off Fridays. She's volunteered. We have a lot of different options.
Yeah.
What positions do you have to have like a nursing degree or an EMT for? Just
so EMS is my guys. That's my ambulance.
Yeah.
Okay. So the ambulance is standing by. This is our guys doing the holding room. They need to be medically trained. Now, whether it's EMT or nurse or whatever, doesn't matter. They need to be able to respond. If somebody has a reaction, they need to be able to respond immediately. Okay, that's their job. These are the vaccinators.
Mm-hmm.
And this position here will always be one of our fire medics. That vaccine manager, he's the person who's drawing up the vaccine for everybody. So that way we have a consistent draw up every time. It'll be one of my medics all the time.
So, Kristen, do you want me starting the second week to have people just contact me and I can put them in?
No, I'd rather share the link. We'll share it. Lorraine or Chief will plug in their guys in their key positions. So you might want to write vaccine manager, fire department in parentheses, so people don't try to sign up for that. Like we're clearly but I think it's good that we can all visually see that because vaccinators, you could just say must have current license or some comment like that, and we'll be plugging those in. But over time, we have a lot of people who want to help vaccinate. So I think we're going to fill those positions very easily.
What we're going to end up with eventually is these guys here are going to get burned out. Okay. Yeah. Here's all my guys, right? After a while, after doing this every Friday, they're going to get burned out. So we're going to end up with probably 3 of my vaccinators and 3 somebody else every week eventually, and that way, and over here maybe one of my guys and one of somebody else, so if we I'd say FD 3 FDs, and we float from there.
And where do you guys put this so that everyone can see it?
You can, it's mine.
Oh,
I'm not sharing it with anybody.
Well, I think once we move, Allie, if you can move us to like a my sign up format, then
like
we'd all have
like
access.
a Genius. Okay.
Yeah. I use my sign up normally. We can talk offline. Whatever one works for you. Okay, excellent. So yeah, if you guys think of anything, again, we'll have that 1 hour window. And if you can't get here right at 8 o'clock on Friday, don't stress. You've been through the training. I'm sure we could get you up and running. Obviously, anybody at that end, has a little bit more time to get here if needed. So you have a conflict or anything comes to mind, please let us know. But we should be well staffed. We, again, have spaced out. We have about 33 appointments an hour. This should be very manageable is our hope. And that's what we're hearing from others. So we're not trying to go gangbuster with, unrealistic expectations this first week.
Allie, I got your picture. Teresa, I got your picture. I've already created yours. I'll be creating yours later. Diane, I haven't gotten a picture from you yet. I need a headshot from you. And David, why don't you send me one, because if you're going to be there wandering around at any point in time, you should have some ID on. Yeah, perfect. Hey, I can just take a screenshot right now.
I have a
Perfect.
question.
Yes.
I feel silly because my chief's sitting right next to me. But am I able to volunteer on Friday mornings from 9 to 12 where I'm scheduled working?
You're not volunteering. You're working as staff.
You're working.
Oh, I'm working as staff. Okay.
Yep.
Okay. Thank you.
Yep.
All right. Great.
She has no choice. I'm just sending her. So she really doesn't have a choice. She just doesn't know that.
Awesome. Well, thank you so much, everybody. We'll be in touch.
Okay.
If you have questions, please reach out.
Thank
Okay, guys.
you.
Bye.
Thank
Good
you.
stuff.